Nigeria has some of the smartest doctors in the world, yet patients die from conditions that are completely treatable, honestly. So the question is, why is the Nigerian healthcare system failing us? And more importantly, what can be done about it? I know that we've had conversations, thousands of conversations about Nigerian healthcare system, what's happening to it. We a lot of times we showcase situations or cases of our primary healthcare system failing and a whole lot of things. But Nigerians are completely divided about what the actual problem is. If you ask an average Nigerian now, why is Nigerian healthcare system like this? They probably may not even tell you or may not know what the actual issue is. Some may just say, okay, doctors are completely unavailable, doctors don't know how to do their job literally. That is the easy reply for every average, for most average Nigerian. But then the problem is deeper than that. It's not just about having bad hospitals. Like, let's really be honest. It's something way worse than that. There are a whole lot of factors that are responsible for the Nigerian healthcare system being the way it is. Some of the problems, from my perspective, of the Nigerian healthcare system include severe underfunding, the poor or very weak primary healthcare system, the lack of proper emergency structure, the lack of health insurance for the common Nigerian, literally. And to top it off, most patients hardly present to the good hospitals early enough. Now, let me paint a scenario. A patient is ill, is sick. He goes to the primary healthcare center in his community or in whatever community he finds himself. He gets treated. His health insurance pays for the hospital bill, and he goes home literally. That is what is supposed to be our reality. That's what should happen in an ideal environment. But our reality is this: an individual is ill, or an average Nigerian is ill. He thinks about, oh, what could likely be the problem? I don't have strength to go and start standing on the long queue in the hospital. I don't even have the money to pay for the hospital bill they are going to give to me, because I hear is quite a lot. And because of that, delays going to seek for medical advice or medical care that he requires, that he needs. And his condition continues to deteriorate. He doesn't have health insurance to even cover up for whatever bill that is going to be provided, or to subsidize whatever bill that is going to be provided to him. Over time, his condition gets worse, and he presents to the emergency center or emergency room at the federal or tertiary hospital, instead of earlier presenting to the community health center closest to him for early treatment and possibly prevention. Yeah, he presents to the tertiary hospital facility that is already overworked, that has thousands of patients in the hospital already, that have limited supply of hand gloves, latex gloves, syringes, that have very limited supply of even continuation sheets to document for patients, for crying out loud. And this patient too do not have health insurance. So he's being told to do very expensive investigations. After doing those investigations with like paying out of pocket, he comes to the hospital. Yeah, he's told to buy syringes, buy gloves, buy, like, even before his treatment. So he buys those things. He's literally later told to buy medications that he's going to need for his treatment. Further into his management here, he's told, okay, this is the amount, or this is what your bill is amounting to. And he can't be able to pay for that bill. He can't be able to afford the bill. He now extends his stay in the hospital. The hospital definitely will not let you go without paying them their fee. There's some patients too that no matter the length of stay in the hospital, they can't be able to provide for the amounts that is required for their discharge. Yeah, we once had a patient that had to stay in the hospital for up to 3 months post discharge, and now developed bed sore, and later had to remain in the hospital for longer because he was not able to afford water bed or other basic necessities literally. And I know the average Nigerian now will look at this scenario and be like, okay, doctor, can't you guys contribute for these patients? Can't you guys contribute the amount of money this patient requires to be able to pay this, and get discharged from the hospital? Now, for how many patients, let me ask, for how many patients are we going to continue to do all these things for, literally? And from what salary? That's by the way. So it's like a chain of failure, literally. But our problem or the solution is not to build good hospitals everywhere. But what's our idea of a good hospital, by the way? It's not to build hospitals in of Nigeria without having people to be in those hospitals and people to manage them. If I were to summarize my solution for the Nigerian healthcare system nightmare, literally, I would say it's to fix the primary healthcare system. Now, no healthcare system works if the foundation is faulty, and the foundation of every healthcare system in every nation is at the community level. Just like when you want to win elections now, you need to go to the grassroots. Now, it's at those grassroots now that the community is, and it's at those grassroots that the primary healthcare systems are, and that is where needs fixing. This primary healthcare system provides basic diagnosis, literally, helps to conduct basic investigations, does early treatments and referrals, literally. So it's from those primary healthcare system that individuals with more severe cases are being transported or being referred to other tertiary facilities or to the general hospital, literally, for further care or further management. Yeah, but our structure is so terrible that a patient with malaria goes to a tertiary facility, a freaking tertiary hospital, for treatment of malaria. What happens to the primary healthcare system? I'm not saying it's supposed to be an absolute thing, but then what is closest to you should be the primary healthcare. But our reality is that these primary healthcare centers are understaffed, they are under equipped, and they are underutilized. But then we need it to be properly functional to provide for the basic necessities that are earlier outlined. My proposal is that there should be at least one functional, emphasis on functional, one functional primary healthcare center in every community. I don't know how many communities there are in Nigeria, but then if we have one in every community, or even maybe two, for what is what, yes, and not just to have a functional healthcare system that will only be functional for 1 month, like a system of maintenance, a system where these places don't go out of order, these places don't go out of function, literally. Now, the first thing is staff. A lot of these primary healthcare centers are largely or grossly understaffed. The second is that they are under equipped. Now, if you enter a primary healthcare center, most primary healthcare centers do not have the basic necessities for basic investigations. They tend to outsource these things. If you need any investigations to be done, you outsource it, and that is not what is supposed to be. A lot of these primary healthcare centers don't even have electricity. Now, this is why I say that the Nigerian healthcare system failure is a systematic thing, literally, because it needs a whole lot of things to be functioning together. If you have something as simple as electricity now, I'm sure there are a whole lot of, like, you've solved 40 or 50% of the Nigerian healthcare system problem. You've solved 40% of the Nigerian and average Nigerian problem. For drugs, pharmaceuticals, necessities to be provided at these facilities or at this center, sorry, for adequate management or adequate health management, and for a good referral system, we need ambulances. Like, where we get to even see ambulances are at private facilities or at tertiary facilities. That's where you get to see ambulance, but that is not how it's meant to be. It is from these primary healthcare centers that cases are being referred, if for want of like an emergency case or whatever, be referred to a tertiary facility, to a general hospital, for proper management. Now, the next point is health insurance expansion. I figure that one of our major barrier to health care in Nigeria is money. Like, a whole lot of people do not have this money. Even the middle class now, some would say that they've literally eliminated the middle class in Nigeria, and I wouldn't doubt that, because even the middle class now cannot be able to afford some basic investigation. Let's talk about investigation first. Talk less of treatment of a major medical condition, and it's really sad. I don't want to talk about ignorance. I don't want to talk about all of those. And I know that we already have the National Health Insurance Authority and all of that, but it needs a wider coverage. The coverage it's very poor, it's very low. So we need these things to be made put in place for the average Nigerian should to have access to them. I know that it is not everything that the health insurance company is going to pay for you, but for Christ's sake, it subsidizes the prices. It subsidizes the prices so that at least a middle class in quotes can be able to afford for expensive health care. And lastly, to simplify the enrollment, I know that a lot of bureaucracies around the whole health insurance, you need to do this, and blah blah blah. But like you need to simplify it for the common man. Common. Another point is that a lot of tertiary facilities too do not have the necessary requirement for management of patients. Some people, I spoke about this in one of my videos when I was talking about the harsh reality of being a doctor in Nigeria, yeah, or working as a medical doctor in Nigeria. And a lot of tertiary facilities do not have all it takes, do not have necessities literally to care for individuals, to care for patients. And that is why we come to social media and there's talk of there are no gloves. So like the doctor was not able to perform his activity. Like who are you freaking blaming? Is it the doctor for not having gloves? Is it his duty to provide those things? But yes, that's by the way. So yes, these are basic necessities that every freaking hospital is supposed to have, and they don't have it. So if you do not have the basic things to keep the tertiary facility running, how much more the primary healthcare center? We need these things to be able to provide emergency care. I'm not even talking about the more like the big things. I'm talking about these little things to keep things going, to keep things running, literally in health facility. So let's talk about the elephant in the room. Yes, the healthcare workers. Now, these are the foundation of, or should I say, the functioning parts of the healthcare system. We've talked about the structure, we've talked about primary healthcare centers, we've talked about providing materials and all of those things. But if you do not care for the people that make these places up and running, if you do not care for the people that provide care, how do you expect them to provide more care? Yeah. So how do you expect them to provide care? You don't pay them on time. You pay them small amount of money. They go on strike. They shut down the hospital. You do whatever it is you can to make them come back, and the cycle continues. Like how freaking long are you going to be treating them the way you exactly do? Well, this video is not to talk about the problems of the Nigerian healthcare system. It's to talk about the solutions. So yes, provide adequate necessities, provide increase their payments, give them benefits, provide things that remunerations that would encourage them to even want to come to work literally, because these people are leaving the country in troops, in drones. We are leaving the country in drones. So if people come out and say doctors are leaving the country, well, it's not hard to see why. You see how they are being treated. You see doctors going on strike, you see consultants going on strike, you see regis going on strike and complaining of very terrible working conditions in the nation. But what do you do about it? What do we do about it? So yes, improve their pay. My proposal now: improve their pay, improve their salaries, provide better training opportunities, better training environment for them, make them feel valid, and pay them their salaries on time. Prompt payment of salaries. Like I don't even think we should even be waiting for more than 5 days before you're being paid your salary. Right now, house officers are crying for their salaries, and it's crazy. It is freaking crazy. For over 5, 10 years, when I was in medical school, they've been crying for salaries every freaking year. They've been an incident where they were told we've not been paid our salary, and this is as at the time of recording this video, this is 21st of March, and you've not been paid salary for February. That's crazy. Lastly, my last proposal would be accountability and management. Like every freaking thing you put in place needs to be adequately managed for it to stand or last for a very long time. You can't put up a structure bring the best of the best investigation or diagnostic machine and keep there, and then not think about management 5 years, 10 years from now, not think about who will operate these devices, not think about all of those nitty gritties. That is that is what we call building a white elephant project or carrying out a white elephant project, literally. Because if the things you put in place cannot be able to provide value or improve the value or the health of the community, then I don't think you've done anything good. Now, accountability and management is the hardest I get, but it is the most important if we need to revive our healthcare system in Nigeria. There should be transparency in funding, there should be proper hospital management. We are not supposed to be running after or looking for solutions. We are supposed to be proactive in the sense that before the hospital materials get finished, at least somebody should be notified about it. Something should be done about it, literally. We should not allow ourselves to go for a period of lack and then boom, you get things, and then another period of lack and then boom. That is still not how an ideal situation in the healthcare system should be. And lastly, accountability at literally every level, because without accountability, even the best of the best policies will fail. So, can Nigeria fix its healthcare system? Absolutely. Will it fix its healthcare system? Well, we'll find out. And the truth is that we have a freaking long way to go, a very long way to go. And there is no one magic solution. I don't expect things to turn out for the better or to start being good like all of a sudden with the click of a finger. I get it may take time, but then one simple movement in the right direction will go a very long way. So, this is my perspective, but I want to hear from you. What do you think is the biggest problem in the Nigerian healthcare system, and what do you actually think are the solutions to these problems? If you found this video valuable, do well to like and subscribe. Yes, subscribe, and do well to share this video to others so at least we get informed. And I'm going to catch you guys in the next one. Peace.